Welcome back and thank you for staying with us. Chief Nutritionist for the Ministry of Health, Lisa Hunt, reveals that her department is looking into the idea of placing higher taxes on sugary beverages on island. The aim of this move is to tackle the island's serious issue of non-communicable diseases, especially diabetes. Rochelle Gonzalez reports.
The island's chief nutritionist has revealed plans to go the route of sister island Barbados in the fight to tackle St. Lucia's infamous epidemic of non-communicable diseases, especially diabetes. Lisa Hunt said sugary beverages are in the firing line as they play a major role in the overconsumption of sugar by locals. The weapon of choice to tackle the issue, she revealed, is higher taxes.
Sugar-sweetened beverages have been shown to be associated with many health conditions, including hypertension, diabetes, obesity, migraine, and even osteoporosis, which is softening of the bones. In countries such as Barbados, they have instituted a tax on sugar-sweetened beverages. A study was conducted from 2013 to 2016, and what they found was that sugar-sweetened beverages the sale of them has actually decreased. This shows a positive impact on the sales of, or the consumption rather, of sugar-sweetened beverages. So therefore, taxing sugar-sweetened beverages, especially soft drinks, will be beneficial to us because of some of the health problems that are associated with them.
Hunt said her department has been working tirelessly to restrict access to said drinks at the school level.
The Ministry of Health with the Ministry of Education is trying to get the soft drinks and also the sugar-sweetened beverages out of the schools because of the negative impact that it has on health, and not only on health but also on the behaviors of children. And we find it's imperative that we do so. In 2014, we conducted a research looking at soft drink consumption in secondary school children. What we found that most of the children who consume soft drinks actually acquired it from the schools, so they consume it mostly at break time or at lunchtime. So this tells us that most of the drinks that they are consuming are at the schools. So if we ban soft drinks from schools, we know that the consumption will reduce, and this is what we are aiming to do. We also found that the vendors around the schools can pose a problem because of, even if the school canteen is not selling the soft drinks or the sweetened beverages, that they do have access to it. So we need to come up with a plan where there will be healthier options for the school children, because what we are concerned about is not the livelihood of the people who are selling the drinks, but the health of our children.
St. Lucia currently holds the unsavory record for having the highest number of diabetes cases per capita in the world. Reporting for Hot 7 News, I am Rochelle Gonzalez.
Meanwhile, the president of the Diabetes and Hypertension Association says whilst he applauds and welcomes the idea of tackling the overconsumption of sugary beverages, the method of taxation could come with a sizable backlash. Andrew Felix asked, what's more important, the nation's health or wealth? On the topic of taxation and safety labeling of sugary beverages, the argument, he said, swings both ways. He says he's not blinded by his position and sees the magnitude of the decision if heavy taxation or crippling labeling is heaped on sugary drinks.
It's going to have economic consequences, especially to the lower income persons who rely on satisfying children and getting quick fixes for themselves, having tea with sugar and all those kind of things, because we grew up with bad habits. There are other countries bigger than ours who are implementing taxes, like the UK are considering it real soon. Mexicans are the world's biggest consumer of fizzy drinks. Mexico government recently introduced the first sugary drink imposed tax at a national level. So it's going to happen. But what we do have to look at is, and we have to ask ourselves as individuals, are we still going to be addicted to sugar? You know, are we still going to be colouring chicken with sugar? We don't colour fish, but we're colouring chicken. We need to start weaning ourselves off these cancerous, causing products, and products which are causing the buildup of toxins in our body.
Felix noted the addiction to sugar is one that is widespread. He provided a simple remedy to assist those who are ready to make a change in their lives.
If you're addicted to sugar, wean yourself off it. You will know if you're addicted to sugar every time you have a cup of tea. If you have to put 2 teaspoons or 2 tablespoons of sugar in your tea, you're addicted to sugar. If you have a cup of tea and you have no sugar in it, and you try that for a week, I guarantee you'll come off the sugar. But if you're doing 2 teaspoons, try 1 teaspoon, gradually take yourself off it. But like I said, it will have a social and economical effect on and consequences, especially to the low income people.
Felix asked the question, if a sugar tax is imposed, where would the monies go? He says he hopes if it comes to pass that the tax collected will be invested into diabetes or cancer organizations. A hefty donation was made to the St. Lucia Blind Welfare Association by Massy Stores St. Lucia. The supermarket chain conducted an island-wide donation throughout the month of May, which generated over $16,000, which was donated to the association on the 13th of June outside the waterfront branch. Solange Alfred reports.
The month of May was observed as Blindness Awareness Month, and throughout that time, the St. Lucia Blind Welfare Association sought to highlight the many facets of blindness awareness that are often overlooked. The month also gave chance for corporate entities to play their part in assisting and raising awareness on the issue. Marketing and Corporate Communications Divisional Head Massy Stores, Soraya Best, says Massy Stores created an outlet for corporate St. Lucia as well as the St. Lucian public to support the St. Lucia Blind Welfare Association through charitable donations.
And boy, did St. Lucia support. Not only did St. Lucia support, corporate St. Lucia also came on board because as part of the activities to raise funds, we also had crazy socks. And you would have seen Massy Stores team members wearing crazy socks on Friday the 31st of May, which was actually the Regional Day of Blindness. And during that activity, we collected monies from staff, from customers.
Executive Director at the St. Lucia Blind Welfare Association, Anthony Averill, notes the continued effort made by the supermarket chain Massy Stores is one that the SLBWA remains indefinitely grateful for.
You, the media, and St. Lucia would know that the St. Lucia Blind Welfare Association has been facing major financial challenges in the last couple of years. And we must say, were it not for the support that we have received from the St. Lucian public, the St. Lucia Blind Welfare Association would have had no choice but to close its doors. When Massy Stores agreed to cooperate, and they did not only say, well, okay, yes, we'll help you guys, but they were very proactive. They got all their staff involved, their stores from around the island, and also shared with us their ideas as to how we can ensure that this project succeeds. This is the kind of assistance that the St. Lucia Blind Welfare Association needs, because it belongs to St. Lucia, it is serving St. Lucians, it has earned the respect and admiration of other countries.
The check presentation was held outside Massy Stores' waterfront branch, as this was the location where the largest sum of the donations was collected. On hand to present the check to the SLBWA was Miss Massy Stores, contestant for the National Carnival Queen pageant, Miss Naomi St. Remy. The SLBWA received from Massy Stores a total of $16,530. Reporting for Hot 7 News, I am Solange Alfred.
The Victoria Hospital is the recipient of a gift that is sure to bring some much-needed relief toward meeting the different needs and daily requirements of patients. The gift is in the form of a donation of wheelchairs from the MNC drugstore. More in this report from Fresnel Neptune.
The management of Victoria Hospital was recently presented with a donation of wheelchairs thanks to the generosity of the MNC drugstore. The wheelchairs are expected to assist with transporting patients around the hospital. Medical Director of the Victoria Hospital, Dr. Alicia Eugene, says Her organization is very pleased with the timely donation and believes it will play a significant part in the public health system.
These wheelchairs, the donation is needed. It's timely and it's appropriate. And as you know, if you look at the topography of this present structure, we need the wheelchairs to move patients from departments to another and also up and down the hill. So the wear and tear on the wheelchairs, it's something that happens regularly, and we always need more wheelchairs to allow us to move patients as the patient load increases.
Minister for Health and Wellness, Senator the Honorable Mary Isaac, expressed gratitude to the MNC drugstore and says this donation will provide great assistance in the health sector.
We really appreciate this effort that you have made to keep us in your in your thoughts when you were looking at allocating these requests and gifts to the different sectors of our society. As you know, this is very far-reaching in that sometimes we actually have people who are living here who need a wheelchair to go with. So I am hoping that we will also be able to do this at least with a few of the wheelchairs.
General Manager of MNC Drugstore, Frederica Joseph Leon, says her organization is very pleased that they can contribute to part of St. Lucia's health needs.
Of late, there has been a noticeable increase in letters for health aid. And so when the opportunity arose to collaborate with a business partner of ours to actually get 19 wheelchairs, 15, to St. Lucia, my heart soared. I was so happy. One can only imagine the logistics involved in getting those wheelchairs to the person most in need. And so after consultation with my team, I decided the people who could best handle this would be the people at Victoria Hospital.
A total of 19 wheelchairs were donated to the Victoria Hospital. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennel Neptune.
This is the Hot 7 Nightly News. Stay with us. There's more news coming up after the break.